granola bar like this one. This is the main that we have, but depending for how many people, we make it bigger. Then we have our... Hello, welcome. I'm Dr. Whispers. Oh yeah, I remember you. How are you? You're here for a touch-up of your fillers? Excellent. Please take a seat, feel comfortable. Okay, so let me see your medical history. I think we did it last year, if I'm correct. Okay. We had okay, a design of lips and fillers. That's it, isn't it? So it wasn't that big of a change. I just wanted to try it on, right? So, how was that? Do you enjoy it? Quite a lot. Yeah, sadly it doesn't last that long. You need a few touch-ups. But we do have the option to go with permanent fillers. But that does take a little bit more of time and preparation. You want to continue with the touch-ups? Oh, okay. You want another fillers? Oh, yeah, of course. Here in this area? Well, you know the drill. We're gonna do first an inspection. So mostly you want your lips and a fuller shake in the area. Yeah, can definitely be done. First, let's see your face features. Do you want to be something bold or barely noticeable? Yeah, I do know the trend right now. It's a little bit bolder than I do enjoy, but it's always what you want, what you wish, and I'm just gonna direct you on what looks better for your facial structure. Okay, but you're the one that is in command here. Whatever you want. Okay. So let's take a look at those lips. Okay, you're wearing some makeup. Let's take that off first. Now I see here that it was around spring that last year, isn't it? Okay, yeah, definitely by that time it's already been absorbed by your body. Okay, I'm gonna remove your makeup. I'm gonna go a little bit bolder now with your lips. Okay, so now, if you want to maintain the shape that we are going to be doing, as I was saying before, you will need regular touch-ups so you can maintain the exact shape that we are going to be creating again, because by this time your lips are really back to normal, to what it used to look like. Your natural shape. So if you want to create a completely new design, you're gonna be needing more regular touch-ups. Okay, just so you know. Can you close your eyes, please? Okay, I'm not gonna remove your eye makeup, just right here under the eyes, but I don't want anything to go inside there, just for your protection. Okay, so let me see if I have a before and after picture here in your file. Let's see. So it was by that time. Okay, yeah, I see the difference there. So it was not that noticeable. It was actually very natural looking, only a little bit fuller and with a little shape there. Okay, we're gonna be doing your lips first, then we're gonna be moving to your cheeks. For your cheeks, you're telling me that you want it to look a bit bolder, right? Yeah. Well, we can work that out here. Your face structure is very beautiful, very symmetrical. So we can work that out. Just giving it a little bit of fillers on this area in specific right here where I'm touching. Yeah, this is the area where most makeup artists put that glowing powder. I don't know much about makeup, but it looks very cute. Yeah, I've seen some Instagram models wearing that and it's quite beautiful. Okay, so we don't want to go over the top because it's the first time, so it's gonna be looking very weird if we go very bold. So you want it to stand out, but we need to do it in a way that looks according to your face structure. Okay, do you have any problems with your weight? Do you tend to gain or lose weight very often? Okay, I'm asking this because the face is one of the first parts that gain weight. When we are gaining weight, is the first parts that get a lot of fat. So our cheeks can grow and can mess up a little bit the fillers and can look a little bit bigger than it should be because you're using fillers at the moment. So if you tend to gain weight very often, or maybe you have a thyroid problem, it can happen. Okay, yeah, because we have to take that into consideration, that if you are tending to gain or lose weight very often, very easily, we can make it a different way, and it can work with the growth of fat in the face, so it looks natural during the weeks that it's gonna last. Okay, now this area in specific, this is where I want to work the most because it goes down here in the cheeks. It looks very nice, really nice right here. This angle is very beautiful in your face, so we enhance this area in the cheeks will look bold and beautiful, and with makeup it's gonna stand amazing. Now for your lips, I have my shirt here. Let me show you. Okay, I'm sure that you're familiar with this from our last appointment. So we have the shapes that I normally like to do in my patients, and that is mostly common right now. So we have the fuller lips here, very pouty mouth, but it's still natural. We can go a little bit lower here to make it bolder if you like. We can create the Cupid's heart if you will like, applying some fillers on these areas in specific. The same, we can do it here, depending on how wide your lips are. We can widen it up in this area and create the Cupid's lip. If in your case, yeah, we can definitely create it. Now, let's see your white. Okay, we're gonna take a few measurements before we do that, okay? Now, most of my clients that come here for filler have this type of lips. A little bit thin on the top, right here. And for that they don't want to create a very bold, more natural way, I think we can go with this one. In your case, since you want to step up a little bit more from your first fillers, I think we can definitely go with number 2. Right here, dotting these lines, creating that beautiful Cupid's heart right here. As you can see, its curve is not as sharp as number 3 here. You can see it here. So I think in your case and your face and lips shape, we can go with number 2. Yeah. I believe it's the best choice for you. Okay, just one moment. Let's put up a little bit more of light. And prep you up. Let me know if it's too tight. Just gonna tuck your hair in, like so. Okay. Is it too tight? You okay? Good. Now we need to take measurements of your mouth. Let's see if I have it here. Okay, let me take notes of this. Okay, looking straight forward, very straight, mouth serious. Okay, good. Okay. Now don't move. Okay, very good. Excellent. That's it. I'm sorry, I don't remember. Do you want to have numbing cream? Okay. So we're gonna be doing that. Okay, I'm drawing a model of how I'm gonna be doing your lips today. Measurements that I took here. Okay. So I'm gonna start first by numbing your skin. We already have what I want to do here in your cheeks for the fillers. And let's move up to the numbing cream. It's gonna feel a little bit warm while I'm applying it, and then you're gonna feel nothing. Okay, close your mouth. Like that. Now can you pout a little bit? Like that? Good. Now, don't touch it, don't taste it at all, okay? Because it's extremely bitter. I'm gonna put it all the way outside your lips too. You're gonna feel that tingling sensation in your lips. Then very heavy, very weird, warm. Then nothing. You're just gonna feel the pressure. Okay. Good. I'm gonna do the same in your cheeks area. that there. Now let me show you the needle that I'm going to be using. As you remember, it's very, very tiny. Extremely tiny. You can barely see the needle right there. So I'm going to be injecting the solution directly into the areas to create the shape that we want. There's going to be several ones. There could be a little bit of blood, but there should be no pain or discomfort. If at any moment you feel discomfort, let me know immediately so I can stop and put more of the numbing cream. Okay, we're going to be doing first your lips, then we're going to be moving up for your cheeks. Okay, let's do the touch test. I'll be touching you with this. Let me know if you can feel it. Okay, first in your lips. Good, 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 good. Again. Good, 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 good. Okay, in your cheeks area. You just feel the pressure. Okay, I'm going to apply a little bit more pressure. You feel anything? No? Good. Now here. Feel anything? Just the pressure. Okay, again. Just the pressure. Excellent. And here. Good. Here. Very good. Then you're ready. Let me get my needles ready for you so we can just start. It's gonna take more than 15 minutes on your lips and cheeks. Now I'm gonna be moving your lips with my hands, okay? It might feel a little bit weird because it's numb. Okay, good. Here we go. Try not to move, okay? Good. Good. Need a new one. Good. Doing great. Okay. Just feel the pressure, right? That's all you should be feeling. Good. I'm going to be manipulating your lips. Okay, here we go again. Try not to move. You're doing great. We're just wiping up a little bit of the excess. You're doing great. How are you doing? Feel good? Feels a little bit warm? Okay, that's good. But let me know if you feel pain at all, okay? Don't be shy about it. Good. Okay, in your case, since your lips aren't this wide and it's a little bit more, have to be very careful not to put too much and be careful about the shaping. That's the most important thing here. Okay. That looks good, quite good. Okay, yeah. Now can you pop like for me? Like that. Now open up your lips a little bit. Okay, very good, thank you. Close again. Great. Very nice. Almost done with your lips. That looks great. Actually, they expanded quite a little bit from our last time. And it's been easier for the fillers to act up, so it's working great. Very nice shape. I especially love how it looks on the Cupid's heart. Yeah, now people is able to get the sharp Cupid's lip that requires a little bit more of work and some stitches in some cases if you want to create that shape in a specific. Yeah, I do it quite a lot with permanent fillers. Yeah, with permanent fillers we use, instead of this, we use your own fat. We take it from other parts of your body and we inject it into the areas that we want to make fuller. Could be the buttocks, your lips, many other parts. Excellent. So this is our last needle for this, for your lips. And I love how it looks on you. Very natural, doesn't look artificial. It's gonna be swollen for a bit, but you already know that. And the last one, there we go. I know the sensation is so weird because you don't feel anything in your lips. So me manipulating your lips, it's a very weird sensation. Okay, good. That looks great. Let me just fill this up. Okay, lips are good shape. Nice, full, perfect. Let's see. We're gonna move now to your cheeks. Okay, this one is a bit tricky. I'm gonna do some markings, okay? So I can work better. So we have the middle right here. So we're gonna start. This is the central area. We have the middle here again, down to the central area of your cheeks. So this is the area that I'm not gonna cross. Right there. Now, let's begin, okay? Now this is work where I have to inject and see how it's developing. and kind of shaping it around. We don't want you to look like you've been punched in your face and got swollen. So it has to be in very specific ways and areas. Looks good. Okay. We're going to be needing 3 needles each side. Anyone? Okay, that looks good. Okay, we're gonna leave it there. I'm gonna start. Okay, I'm gonna finish the second one here. There we go. Good. We're gonna leave the third one for the end. I just wanna make sure it's gonna look even on each side. And next, this one. Now in this area, you have a few freckles here. Cute. Now, okay, when I manipulate this area, okay, we're almost done with the first nail on this area. Sometimes it's more of looking how it looks on each side. Make sure that it's even. That's the most important thing with cheek fillers, because I have seen some works on Instagram. That one is up here and the other one is right down here. No, no, no. That's why it's more important, the markings. Very, very important. How are you doing? No pain? Discomfort? Okay, now we're into the second one. That looks quite nice. Okay, very even. I'll take measurements in a moment, just to make sure. Okay. Very good. So before we put the third and last one, let me take measurements here. There we go. Okay, looking straight forward. Very straight. Okay, good. Good. Okay. And that looks great. Very even. Now I'm trying to determine if you need a third one, because right now it looks amazing, but you're telling me you want it to look bold. Okay, I'm gonna show you. You can take a mirror right here, so you can see. Right now it's gonna be more swollen than what it's gonna be. Okay, so this soreness is not the one that you're gonna get at the end. The same with your lips. You can see how pot it is. You like it? Okay, right now it's a little bit weird, but by the time we're finished, it's gonna look great, okay? But here, you see how it looks? Okay, now imagine just a little bit unswollen. We can leave it like that. It's gonna look great, but It's your decision. If you want to go a little bit bolder, we can go with the third one. If you want, we can still do that. Yeah, sure. Look at yourself here in the profile, from the sides, front. Yeah, sometimes we all have some angles that work better for us, so work it out if you like it. Okay, you want to go a little bit bolder. Yeah, perfect. No problem. So we're going to be doing that here, in this areas right here. This area too. The same here. It's gonna go around the center, like so. Okay, that looks great to me. Very, very great. Okay. We're gonna be moving to a relaxing face massage. Okay. First, let me just remove the markings that I put on. Now you notice it in the mirror that is looking quite bold. I'm sorry, quite swollen and red. Yeah, that's gonna fade up by the end of the massage. That's why we do this massage. It's a repairing massage, very soft, very subtle, but it feels great and it's perfect for the fillers. It's not gonna be absorbed or anything. It's just for your relaxation. I really love the result. It looks amazing. Okay. Let me go get the cream. Can you look up for a little bit for me? Now it's going to be very soft in circular movements. You need to close your eyes for this. I'm not going to be touching your eyes, just around the forehead and your cheeks and your chin, okay? So I'm going to do it from behind. It's much better, okay? Very good. How are you feeling? Quite relaxed? Yeah, all my patients love that. I started adding this extra to my procedures and they love it. They leave them relaxed after all those needles. Okay, let me take this off for you. Now you can feel that is swollen. That is going to be completely gone away in around 20 minutes. Now what is important, I want you to regain the sensation in your face. Okay. Let's touch. You feel this? Good. 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 Very good. Now, you shouldn't be feeling any pain whatsoever. You shouldn't be feeling any sensation at all. The soreness is gonna remain, as I was saying, for 20 to half an hour. By then, you're gonna start noticing going down, and then by the hour, that's how it's gonna look, your lips and your cheeks. Okay, you have until tomorrow to see if you like it. We can add a little bit more, not too much, just a little bit more if you want to improve it by tomorrow. Okay, after that it's gonna be full price, but you're gonna have to wait the complete 8 weeks. Okay, I'm gonna write you a prescription for a painkiller in any case that you feel discomfort, but you shouldn't feel it. Okay, you have any questions? No, you're okay. Well, it was a complete pleasure working with you. You look amazing. I would like to, if you want to keep this shape, especially on your cheeks, I recommend you to come by the 6th week for a touch-up with a 10% off. After the 8th week, it's gonna be full price. Yeah, because we have to redo the shaping, redo the measurements and all that. But by the 6th week, we already have your information here, and we just can add the touch-up for fillers. Well, it was a complete pleasure. Take care. You look amazing again, and I hope to see you again soon. Take care. Goodbye. Karen, you can send the next patient, please. Thank you. Very good. That looks great. Hello. Welcome. I'm Dr. Whispers. I was waiting for you. Can you give me your name, please? Let's take a peek to your medical history here. So this is your 3rd time here with us. You have been receiving some treatment for your lips before. Let me see if we have some pictures of your other procedures. Okay. You got an enlargement a few months ago. Last year, actually. And also reshaping last year too, with a slight enlargement. Okay. So today you're here for another reshaping. What do you want to change about your lips? I see that they have returned to its normal shape. That is pretty normal. It doesn't last that long when you don't do the permanent treatment. So in your case, it lasts around 3 to 4 months, depending on how good you take care of your lips. Yeah. Okay, let's see. We have used injections on the last session, but no permanent shaping. Okay, the enlargement, we can do it, but as it says here that you have booked your appointment for a permanent reshaping, it's very different from what you're used to and what we have been doing here before. If you remember, we have to change the type of lips that you have right now and specific how they look. It says here that you want to change the upper one, just one, that one in the shaping. So right now the shapes that we are currently doing will be the Cupid's heart, which is this one right here, as in the number 1. Not all people have it. Some people have very flat lips on the area, so we try to recreate the Cupid heart, I'm sorry, in this part. We can do it very sharp or in a curved way, which will be number 2. We also have the number 3 that is also a little bit sharp, but with the curvature at the center right here, which is pretty different from this one, the first one, which is more pointy. This reshaping takes around 10 minutes or so to do it. It involves applying local anesthesia in the area, along with injections and a little bit of sutures. It will be internal. There will be nothing showing on the outside, but there could be some bruising for, well, it depends on the person, but more or less a week or 2 maximum. So just so you're aware that during those 2 weeks there might be bruising on this area right here, and it's not gonna look kind of pretty. Can be covered with makeup, but the top part needs to be covered with gaze for around, let's say, 3 days. After that you can apply makeup, and it's gonna look swollen for a week, but after that just covered your bruises. I wanted to tell you this beforehand if you want to go along with it, or you want to do a normal reshaping that takes and lasts for 3 months or so, the ones that we have been doing before. You want to go with the permanent one? Yeah, of course, no problem. So we're going to start first by analyzing your current lips and see what are the special needs that it's requiring this time. So you want to go with number 2, you're telling me? Oh, number 3, I'm sorry. Okay. So now we have to see if your lips are candidate for it, for the permanent one. It's pretty easy to do it with injections, but for it to last a lifeline, it takes a little bit of difference. Okay, there is a lot of dryness in your lips, quite a lot. We're gonna have to do an exfoliation before we can go with the procedure of enlargement and reshaping. Let's see. So we can definitely work with the Cupid's heart here, we just have to raise your lip on this side, which will be this one and this one. We are gonna be pulling it up for a bit. So as you see here in our chart, you're gonna go with number 3. So in this area in particular, we're gonna pull it up for a bit, and we're gonna put a stitch on top of it so it stays there. Okay, we wanted to move it up right here, so it's gonna get stuck into the upper lip just a little bit, so we can create it like that. And then we're gonna dent it just a lower bit here. I think it's gonna require a surgery here too. We're gonna go and see along the way. No. Yeah, there's a lot of dryness in your lips. Have you got a cold recently? Maybe dehydration sometimes happen when you don't drink a lot of water, or we are in the sun exposure for long periods of times, and that can affect our lips. So as I see here, you're a good candidate for it. We can work with what you have. You're gonna have to pull up just a tiny bit. Let me get my ruler here. Just want to see how much we need to pull up in your case. So 1, 2, 3 should be enough in this case. We want to make it the same on the other side. 1, 2, 3. Yeah, it's possible you have enough skin and lip there. We can pull. If the lip is too skinny, too close together to the bottom, it won't be possible. We have to do the enlargement first, permanent enlargement, and then pull up the lip. But in your case, you have enough that we can work with and do the reshaping, and that will be good. There's a lot of flaking here that might affect the results, so we're gonna do a very nice exfoliation and soothing of your lips. It's gonna feel great. So yeah, we're gonna go with stitches number 3 in your case. Number 3 along with 4. Okay, so definitely it's possible. You're a great candidate for it. Gonna take around 10 minutes or so, and the healing time, as I was saying, depending on how you personally heal, up to 2 weeks. So I want you to be aware of the bruising because it's gonna happen. Okay, now I need you to sign something here that you're aware that this is gonna happen and that it's not gonna look exactly as you want the first day. After the 2nd week is when you're gonna notice perfect lips as you wanted it. Okay, now let me get that print out. So okay, there we go. Now I need you to sign here. You can read it first. It's just say that you're aware that there's gonna be bruising and that it's gonna take around 2 weeks for it to heal completely. Okay, well, I just need your signature here. Excellent. So we're ready to begin now. Let's start with your lip exfoliation. a lot of flaking in here. So let's start by soothing your lip. We're going to be using this cream lip balm of aloe vera, which is amazing for this type of problems. That is amazing for this type of problems. Okay. It's gonna feel kind of minty. Okay. Don't worry if you taste it, it's completely natural. But in the next one, I don't want you to taste it, okay? So be aware of your tongue. Try to place it all the way to the back if it's possible. We're gonna leave this here for a couple of minutes while I prepare you for the procedure. Okay. Let's cover your hair. Let me know if you're comfortable like that. Good. Okay, well that works. I'm gonna clean the part of the middle face. You're not wearing any makeup base, foundation, anything? Good. Now can you do this? Good. Keep doing that while I clean and disinfect your face so we can continue with the procedure. Tastes very nice. The aloe vera, it's very good. There we go. Now let's see. Let's put a bit more. During the exfoliation process can be a little bit of discomfort, but it's necessary to clean your lips of all this dryness and or the flaking that you have. Okay. Now, this next solution, try not to taste it because it's better. Okay. I'm gonna get rid of all the flaking that you have. You can actually do this at home with a toothbrush with soft bristles. You can even use paste, dental paste on your lips. It's completely safe, but do it gently whenever you feel like your lips are flaky. But the most important thing is to irritate them and drink enough water. That's the number one way to have very beautiful lips. Okay, that looks much better. Good. Now pout a little bit, like this. How does it feel? It's softer, isn't it? Yeah, but there's still some cracking here. I wanna be very gentle with it. We don't wanna get any injury to the lips. Because if we do it, we won't be able to do the procedure at all. Okay, that's enough. Okay. We're gonna apply it. This one is also very bitter. Don't taste it at all. There we go. Looking much better. Regaining its natural color. The blood flow is coming back. Normally when we have very dry lips, they look pale. Blood is not circulating well enough to make them look blonde and pinkish in some cases, or darkish depending on the skin tone. There we go. Now the last brushing. For this, I'm going to use a dental brush, completely new. Okay. Yeah, you can use something like this, but don't use the same that you used for your teeth. Use a new one, a different one, just for your lips, okay? This one is new. This is the type of brush that I use for my clients to do the exfoliation of the lips, okay? Very, very gently. You don't want to put too much pressure into the lips and cause damage and cuts. Nice and easy. Very good. That looks great. Excellent. Now, just gonna put a little bit more of aloe vera lip balm and moving down with the lip drawing. I'm gonna draw the shape that your upper lip is gonna have at the end. I want you to let me know if you like it like that. I'm gonna take into consideration the measurements that I took earlier. Okay. Let's dry the area right here at the top. Okay, done, please. So we're going up a little bit here. The Cupid's heart going down in the curvature in the area here. And then up again and going down, merging with your natural lip like that. Okay, now to your side you have a mirror. I want you to look at the shape. Let me know if it's the kind of shape that you want. I can do it a little bit sharper and a little bit more curved in the middle. Whichever shape that you want. That one's exactly as the number 3 as you wanted before that I have here. You can see that it ends in a little curve at the middle. A little bit more pointy in the top. Yeah, definitely can be done. Okay, so gonna make it a little bit sharper at the top right here. That case should stay like that. Just a bit up so it gets like that. Okay, there we go. You can take a peek again. You like it like that? Okay, yeah, it definitely is gonna look natural. Pretty plump. I'm gonna have to add just a bit here. On the bottom, you just want the normal enlargement that you always have. Okay. So we're gonna go along with this shape as you want it. I'm gonna prepare you with the local anesthesia. You're gonna feel your lips like they have no weight. You're not gonna be able to talk properly. In any case you want something, you want me to stop, it's better to touch my hand, okay? Now it's very important not to sneeze or cough during it, because I will be moving along your lips with sharp tools, so just be aware of that. If you feel that you need to cough or sneeze, try to warm me beforehand, okay? Very good, that's a very nice shape. It's gonna work great. Let's start with the local anesthesia. We're gonna first apply it at the whole area of the face here. It's gonna feel very, very weird sensation. And after that, I'm gonna apply the injection on the top. Okay. Good. It's gonna feel completely numb and warm too. The warm sensation is gonna start first, then the numbness. You're feeling it? Let's wait a little bit so we can continue. I'm also gonna remove some of the fuzzy hairs that you have in the top lip. Okay, for that I'm gonna be using this little blade. How are you feeling? You got the numbness now? Good. Can you feel me blading the area? Shaving it? Not quite. Let's see, I'm gonna touch it. Let me know if you can feel anything. How about this? And here, 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 here. Good. Now I'm gonna apply local anesthesia on the top lip, where I'm gonna put the little stitches. And here we go. Good. Now another one. There we go. Now give it a little massage. It's gonna feel weird. Yeah, weird sensation. Okay, you can feel me touching your lip. Doing this. Do you feel that you have your mouth open or closed? Well, you have it open. Yeah, that's one of the things. Now I'm gonna need you to recline your head to the back. Now I'm gonna put a little braces on the side, just so you don't move your head too much during the procedure, because right now you cannot control your lips that much. So just to have you in one position. Good. Now, the needle that I'm gonna be using during the enlargement on your lips is gonna be this one. Pretty small, as you can see. The needle is very small, so you remember. It's just gonna be the same for the stitches that I'm gonna apply there. It's this one. Okay. Very good. You ready? We're going to start in the upper lip, so we can create the Cupid's heart shape that you want in there. I'm going to be applying pressure on the area so I can put the stitch where I want it and place it in perfect position. Just like that. Okay, try not to move. Good. You're doing great. There's a little bit of blood, but don't worry, it's normal. like that. Doing a great job. Excellent. Your lips are going to look a little bit swollen at the end, more plump than what it's intended. Remember that after a week it's going to go down to normal size, or even a couple of days later. It depends on the person. That looks great. We have put the stitch right where it belongs, pulling your lip up into Cupid's heart shape. I'm gonna show you right now. It's a little bit swollen. There is no blood present at all. Just a little bit of redness, very normal, but I want you to look at the shaping. You can take the mirror right here. Yeah, it looks amazing, isn't it? Just with a little stitch, it's gonna stay there until maybe you want it to go down in the future. It can be done. It's completely reversible. So you like it like that? Because right now is the time. Yeah? Okay, perfect. So we're gonna move down into the enlargement. Lip injections there. Now go back to your position. Like so. Good. And let's go with what we are going to inject into your lips to make them look plump. We're going to be using 30 units on you. That should be enough. Okay. How are you feeling? Any pain, discomfort? No? Good. That's what I want to hear. No discomfort at all. Looks nice. Use the next 30 units. Good. 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 Excellent. Looking very nice and plumped. They're gonna look perfect for around half an hour, and after that the redness and the bruising is gonna start to appear. you know, a week or 2 weeks later, perfect lips again. Okay, we're done to our last 5 units. How is the discomfort going? Anything? Not at all? Good. And we are done. Dispose of that. Okay, take a look again. You have the mirror here. Now I'm gonna work on soothing your lips after all the little injections and the suture that I put. I want your lips to have a little bit of pampering. You like the result? Well, now after the soothing, they're gonna look great. At least for half hour to an hour, and after that, everything that I was telling you about is gonna start happening. Okay. Apply this directly to your lips. Give them a little pampering after all the poking that we just did. I want them to feel good and happy for what they have endured. There we go. There we go. We're gonna end with a little massage with the aloe vera balm. It's a great aroma, I love it. I'm gonna give you a sample of the aloe vera balm so you can use it at home to soothe your lips during the recovery. You're just gonna apply it with your clean finger like this as I'm doing it in a gentle massage. Okay. Very good. Now what I want you is to regain the sensation on the area. So that will take around 5 minutes more. Can you feel anything that I'm touching right now? Barely? Okay, it's losing its effect now. It will go back to normal in no time. So let me update your information here while you rest a little bit. Keep your head like that. So we put 65 units on 30 on each lip for the enlargement, 4 points of suture that I want to take a look again in 2 weeks. You have another appointment to see how well it's been healing, okay? But if at any moment you feel something not going good, come to us immediately. You don't need an appointment. You just want to have to wait a little bit in the reception if I'm taking another patient. But after that, I'm gonna pass you, okay? No need to put an appointment. Just give your name to the receptionist. So we did also aloe vera treatment for exfoliation too. And we also did, okay. Now during this time it's very important to keep your lips hydrated. So keep using the aloe vera daily, okay, with gentle massage. I'm gonna give you a prescription for the pain. You might feel a little bit of stinging sensation after the anesthesia wears off. I'm gonna give you one right now so you feel it. Here, it melts in the mouth. Just one. I'm gonna give you for a week. You shouldn't be feeling any pain after the second day, but I'm gonna give you for a week, okay? In any case, if you have it or not. Some people don't have any pain at all after this, but again, it depends on the person. Okay, you're gonna take this every 6 hours or whenever you feel discomfort in your lip, okay? If you start feeling like the sting, you take a pill. Okay, now you have your appointment for 2 weeks. Do you want it in the morning or afternoon? Okay. Afternoon is gonna be good. So you're all set with your appointment for 2 weeks time in the afternoon, and your prescription is gonna be ready in the reception. I'm gonna give you the sample of lip balm with aloe vera, which will be exactly as this one. You're gonna be applying daily, okay, whenever you feel your lips are a little bit dry. Okay, let's see how they are developing, if you can feel something. I'm gonna touch you with this. Can you feel that? And this. Okay. Can you feel me putting pressure here? How about here? In this area? Like here? Are you feeling any discomfort at the moment? Pain or a burning sensation in your lip? No? Okay. Let me end putting a little bit of sun protection on the lips. Okay. Don't worry, you're not gonna need it. I'm just applying it right now because you had the stitches put on there, just for an extra protection. But you don't really need it. It's just something I like to do. Let me take this off. Okay. Now, one important thing is try not to open your mouth too wide, at least for a few days. Laughing. It's kind of hard not to smile or laugh. So just be aware of your lips, because when you laugh and you smile, you're gonna pull them up to the side. So that can be uncomfortable for sometimes, especially with the surgery that I put on. Just be aware of it, that it can happen. But with the medication that I gave you, you shouldn't be feeling any pain. It's gonna feel a discomfort, like you're pulling a little bit. So just be aware of it, that it can happen. Do you have any further questions? Makeup, as I was saying, in the first week, let's say 3 days time, you're gonna start seeing the bruising completely there. That's when you start putting makeup if you want. Don't put any makeup from today till 3 days, 2 days. We don't want anything there, not even cream or anything, just what I gave you. That's the only thing that you can put in the area. And after that, you can put makeup as you wish, or lipstick, whatever. And any other questions? Well, it was a complete pleasure working with you. Your lips look amazing, very, very beautiful. If you have any questions in the future, or are having a rough time, you can call us or come directly with us in our working hours. Now, here in the reception, they're going to give you your prescription and your lip balm. Okay? Take care. Goodbye. Okay. Hello, I'm Dr. Whispers. I was expecting you. Let's see. We are going to perform a lip augmentation and reshaping. Is this correct? Very good. Is this your first cosmetic procedure? Okay. You haven't never had anything like this, like Botox or any other procedure done in your face or body? Okay, good. Very well. So, what are your expectations regarding your lips? Okay. Well, I believe that all lips are beautiful, but not all lips are created equal. So each set of lips are unique and have a beautiful shape, but sometimes we want to improve it or make it a little different, and it's completely okay, and that's what we are here for. Okay. Right now, these are the types of lip shapes and types that are most common and that most of my patients are looking for. And depending on the lips that you have right now, that we're going to measure in a bit, we can see what type of shape is best for you, because we don't want to add a size of shaping of lips on a certain face type that it won't look good on you. It will look odd and weird. So we want to make it look even in your face, that it fits your face structure, your nose, your eyes. So we're gonna be looking at the shapes that we have here, and depending on the measurements that we take today on your lips, we're gonna be choosing one of these. Yeah, so you're looking to have the Cupid's heart. Okay, the Cupid's heart is this little shape right here. As you see, it goes like into a little heart on the top. It can be a little bit curved or more pointy, depending on what you want, but we're gonna see in a moment. First, we're gonna be taking your measurements. Okay, but before we start, I need to ask you just a couple of questions. Okay, any allergies? So detergent, do you know the chemical in particular you are allergic to? Okay, thank you. No, we don't carry anything like this, but it's good to know and have it in your medical history. Good. Okay, so no cosmetic procedures before. Have you had any colds in the past weeks? Or a cold sore? Anything like that? Okay, thank you. It's very important to know because sometimes when we have a flare-up in our lips, we cannot do the procedure at all. Okay, good. Very well. So, let's start by prepping you. Pulling your hair to the back, just to prevent it from falling while we are working on your lips. Like so. Is it too tight? You're comfortable like this? Okay, good. That looks good. I see that you're wearing a little makeup. We're gonna have to remove it before we do the measurements. Very important to have the true measurements of your lips and your face. What we're going to do with these measurements are making a little map of your face and see what is the correct type that will look good on you. We can do any size you want, but I'm gonna offer you a design that will look good for you, for your face type in specific, for your face measurements, for your nose, your face. Because sometimes when our clients ask for really, really plumped and big lips, it can look odd and, well, not that flattering. It doesn't look natural on your face. But we're gonna take into account everything that you ask for, everything you want in your new set of lips. Okay? Very good. First of all, we're gonna be taking the measurements of your eyes, nose, and lips with this little tool right here. And then we're gonna pass into the lips and remove the makeup. I don't need to remove it right now. Okay, please stay still. Just want to have the best symmetry of your face structure. Good. Your eyes. There we go. Your lips and nose. Good. Can you give me a big smile without opening your mouth like this? Just as big as you can. Okay. Good. Good. Now, from your nose and your lips right here. Okay, now like you're really sad without opening your mouth. Okay. Okay, stay like that. Good. Okay. We used to do this by scanning the face of our patients and running it to the computer, but it was giving us measurements that was not allowing us to do something artistic, you know. And with the reshaping of lips, it's an art. We want to make it make them the most beautiful ones. And doing it by hand, it's the best way to do this. Okay. Now, eyebrows, eyes, and nose right here. Okay. Good. Do you fill up your lips with makeup, lip liner? Yeah. Okay. We're gonna be removing that first. This is an oil-based makeup remover. You need to know the true shape and size of your lips for the next measurement. Okay. Good, 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 good. Okay. Let's see. Okay, I need to see your profile. Okay, taking the measurements from your lips and your nose, lip, upper lip, nose. Good. Very good. Okay. Can you look to the side to see your other profile? Okay. Now for the next set of measurements, we're going to be doing your lips only. We're going to use this tool right here to take exact measurements of your lips, the width and depth of them. Okay, we're going to start by disinfecting our tool. Since it will be touching your face directly. Okay, let's start by taking the measurements of your upper lip. Okay, 0.10. 0.10. Your bottom lip. Let's see. 0.11. 0.11. Okay, let's open this a little bit more. By taking these measurements, we know how much we can enlarge them, how much we can augment the size of them without looking at too odd and unnatural. Let's see, bottom lip right here. Good. 0.3. Okay, now I need you to do like this, fish your lips. Now rest your lips. The upper lips goes a little bit under the bottom lip. Okay. What we're gonna accomplish here is do a full reshaping of the Cupid's heart on you. Make it more prominent. Right now it doesn't show that much. It's flat, so we're gonna plumb it with the augmentation and do the reshaping on this part in particular of your lips, right here. Point two. And with your natural wipe, it can be possible to enlarge it as you want and look it natural. Okay, big smile without opening your mouth. Now this is gonna be a little bit weird, but I need you to laugh as you naturally do it. Okay. Now a surprise mouth like this. I'm trying to see all the expressions of your mouth to see how it will work with the augmentation. We don't want to damage any of the nerves in your lips and prevent you to doing these expressions that we naturally do them. Sometimes with these procedures, they can affect those nerves and prevent you even from smiling or acting surprised. So we don't want that. We want to keep all your expression intact. 20.20. Okay. Now open wide as you can, as big as you can, and stay just like that, please. I know it's a little bit uncomfortable. Bear with me. Need to take this measurement of your lips in this expression. Okay, good. Very good. Thank you. Almost there. Don't worry. I know it's uncomfortable. There we go. Okay. Now you can rest your mouth. You know, doing this kind of exercise is very good for the jaw and for the double chins. It works really good. It exercises those muscles. And the last measurement. Which is 0.35. 0.35. And here 0.37. 37. Okay, I'm running here the computer the measurements that I just took, so it gives me sizing the top size that I can go for it. Okay. Yeah, just what I was expecting. Okay, so what you're currently looking for is having your lips on this kind of shape, more like a plumped round lips, very symmetrical on the top and the bottom, with a curved Cupid's heart that you can see right here. It is curved in this area, and the top and the bottom lips are equal and in a circular size. Very plump, very beautiful. Right now your lips are looking kind of like this, but the bottom one is the size of the top, so you want to augment it both areas to look symmetrical and filled. This area right here, and you don't have the Cupid's heart right here. It's completely flat, so we're gonna reshape it by augmenting this area right here and right here, creating a Cupid's heart, since this area is gonna get on the bottom part. The trick here is to make them look as big as you want right here. So we're gonna be applying our product on the bottom lips right here, and on the top on the marked parts, except on the middle right here. We're gonna reshape it until we have a round shape like this, looking plump and beautiful, and making a special shaping here for the Cupid heart. It's good that with your face, the face structure, the nose that you have, and your eyes, this is a very good shape for you. If you were asking for something too wide or too big as this one's right here, I wouldn't recommend you to do it because it will look really unnatural, way too big for your face structure. But this one, it's just perfect for your face type, so it will look really beautiful on you. The other thing that you were asking for is to have this right here. You know, it looks kind of open. It's the reshaping of the Cupid's heart. Not many people have it. It's something that comes natural on some people, but it can be done. So we are going to be reshaping the upper lip to create it like this. It looks very cute, and especially on round lips like this, it looks especially beautiful, and we can really create it on you. So we're gonna be doing this one right here. Okay, very good. So we're gonna start by prepping your lips. We're gonna put balsam on your lips to protect it, and then we're gonna start by doing a light exfoliation of your lips to remove any dead cells that might be there, and it can get in the way, because when we are doing the augmentation, and if you have dead cells on your lips or they are a little bit cracked up or dry, it can break the lips, so we don't want to get that. We're gonna imitate your lips as much as we can and make them beautiful. Prepare for the product. We're gonna start by applying this cream right here on your lips and do a light exfoliation with our lip brush, which is this one. With circular movements, we're gonna remove all the dead cells of your lips, making it look very soft and actually ready for the procedure. I'm going to be applying it with a brush. Okay, just like that. You don't need to do anything. Good. to really fill the product in, like so. Now we're gonna do the exfoliation brushing. Okay, for this I need you to do this. I'm gonna be very soft with it. The bristles are really soft and they are not gonna damage you, but you will feel a little bit abrasive while I do this. We really need to take our time, soothe the lips, remove all the dead cells. And this is actually something that you can do to your lips every time when you brush your teeth with your toothbrush. Just do a light brushing in your lips. Very gentle, of course. And it will help them look beautiful and remove all that dryness and dead cells that get accumulated on our lips. Now we are gonna moisturize your lips even more because we need them to be flexible for this. And if we have dry lips and while putting the product, you can imagine while getting plumped, it can break the lip. We don't want that. We're here to make your lips even more beautiful than they already are. Okay. Like this, moisturizing your lips even more, letting the skin absorb it so it gets prepared for the products. Oh no, don't worry, it's not gonna hurt. The needles that we use for this are very, very tiny. You're gonna feel just slight pressures in the areas where I'm applying it, but you won't feel any pain. It's not like those injections that are regularly applied. No, we have a better method, but it takes longer because we are doing tiny, tiny, tiny injections on the area, but that allow us to reshape the lip on the true way that we want. I'm gonna show you the needle in a moment so you don't have any anxiety over that. Okay, good. and apply this coat on the top. And I'm gonna need you to do this several times before I remove it. Try not to swallow it at all, please. Okay, now do it. Okay, good. Now let's take all those dead cells out. Your lips look very cute, pink, really pink and soft. You can feel them. Big difference, isn't it? Yeah, it's because of all the exfoliation we just did. It makes the lips feel like new. Okay, so the needle that we're going to be using on you is very tiny. It's applied with this tool right here. The needle goes inside here and is as small as a pin, and the product goes in here, and I just push this button right here and goes into your lip. So this is what we're going to be using today. As I was saying, it's not going to hurt. It's actually very soothing because it's kind of a pressure and it's going to feel warm. That is what you're going to be feeling. But if at any moment you feel uncomfortable or if you feel a burning sensation, let me know immediately. Okay. With you, we have two sizes of needles. The 35 right here and the 40.40 millimeters right here. But with you, we're going to be using the 30 in specific. It's very, very tiny. Right here. You can barely see it of how small it is. This will be inserted in the item that I just showed you, and this is what is going into your lips with the product. Okay, let me just prepare it. Yeah, we took this product in just recently, and it's much better because our clients and our patients get really anxiety with it, with the regular needles, and I understand because, you know, who likes needles? Okay, I just insert it and we close it. Like so. And we just fill it up with the product agent to plump your lips right here on the top. Okay, so we're going to start. I'm going to be very close to you for this. And we're going to start by doing the lower lip. You're going to feel pressure. Here we go. There we go. Felt it? Good, good, good. You're going to start feeling warm on the area and then a little bit numb. That is normal. There is some blood here, but it's normal because we are using a needle, even though it's small. It's still a needle. Good, good, good. Right here, we are plumbing the lower lips to make it look bigger. Good. And that opening that you want in the middle, as I was saying, it will be done on the upper lip. Good. Good. Good, good, good. How do you feel? Good. No burning sensation? Okay. The numbing sensation can be between mild and non-existent or really, really high. So expect that. Normally the products start acting up in 5 minutes. That's when we're going to start seeing the plum. It's going to get a little bit more swollen than the actual size of the lips that you want. That is expected, but after a couple hours that swollen will reduce. But it's not that big of a notice. Good. And the final ones on the bottom. And there we go. Okay, now I'm going to change needles. I'm going to show you how it works. As you can see here, once I press it, it goes down, and that's when the product goes inside your lip. Let me change just the needle. Okay, we're going to start with the upper lip. How does it feel? It's not bothering you? No? Okay. Very good. Okay. We're going to start shaping the Cupid's heart. Okay, let's start right here. We're going to leave the middle intact. Doing great. Very good. bit here. Very good. Looking very good. Okay, on the bottom lip is starting to start filling up. Looks very, very good. It's gonna feel a little bit like swollen and big. That is normal because it's not your natural size of lips, so it's gonna feel like a bit too big for a moment, but you will get used to it. Okay. Normally the reshaping is what takes the longest. The augmentation is pretty easy. We just inject the product and it works on its own, but the shaping is what makes it an art. Okay, right here. Okay, it's starting to plump up. Looking very, very good. Cupid's heart is starting to take form. Okay. I'm gonna let it curve, so need to put a little bit more here. Okay, for the shaping of the middle part in your upper lip, we're gonna use a different tool. It's gonna be directly a needle, but don't worry, it's still very, very small. Not gonna hurt at all. So this needle is done. Okay, for this next part, I need you to open your mouth like this and stay just like that. Try not to close it at any moment. Okay, it's very important. Gonna be doing the reshaping on the middle, so I need you to be very, very still. Okay, it's right here. Okay, good. Right there. That looks very good. Very, very good. Can you look to the side? Very good. The other side, please. Perfect. That looks just perfect. So I was saying it looks a little bit bigger than the side that I was talking about. Just a tiny bit, but it's just swollen. And then it will fade away in an hour or two, sometimes less. Just hope you put in a cream on top so it heals faster. There was minimal bleeding. It was expected, but we just want to help your lips soothe and start feeling much better. The numbing sensation will fade away in about 5 minutes or less. You're going to start feeling like you're not able to talk properly, but that's because of the new shape of your lips. You will get used to it with the days. Okay. I'm gonna give you a prescription ointment for your lips, just like this one, that you're gonna be applying it 3 times per day, in the morning, midday, and night before going to bed. You're gonna do a gentle massage with it to your lips and circular movements on the outer part of your lips and right here in the middle with the ointment. Really gentle circular movements and massage that I'm gonna be showing you in a moment. This will be done with your fingers, clean fingers, of course, and clean lips, no lipstick at all, bare lips, okay? Circular movements, just like this, very soft and gentle. Good, good, good. For just about a minute. Like so. Let's see. Okay, the areas where I applied the product, it's gonna look a little bit purplish, not that noticeable. Don't worry about it. It will fade away in a couple of hours again. I recommend you not to be in direct sunlight for too long. Okay, just for a couple of days. After that, you can do your daily life as you normally do. But right now, for a couple of days, take good care of your lips. Okay, now I need you to open your mouth slowly. Smile for me. Feels a little bit uncomfortable, right? It feels big. You can take a pic in the mirror with that beautiful smile. What do you think? Isn't it beautiful? Completely different, but it looks just like your normal lips, like natural. It doesn't look fake or overdone. Yeah, those are your nail lips. Well, you will need to have some fillers in around 6 months. I would recommend it to come back for a filler up on the top and the middle. The shaping will start fading away again in 6 months to 8 months, or you want to keep them like this. I recommend you to come just for a fill up on those areas. But if you don't feel them, it won't go to your regular shape as you had them before. It will look just a little bit more thin than right now. But if you want to maintain the shape and the size, I recommend you to come in 6 months. You have any questions? No? Okay, so I'm going to give you the prescription for the ointment. And as I was saying, gentle circular massage. Okay, so enjoy your new lips. Thank you so much for coming, and I hope to see you. You have an appointment. Okay, can I have your name? Yeah, I got you here. Oh, I just talked to you in the phone. So you want tattoo cover up and lip and eye tattoo. Yes. Okay, very good. Can you show me the tattoo that you want to cover up? In this side? Okay. Let's see. Oh, it's a little hard. It's not that big. It will be easy to cover up. We just need to match your skin tone and cover the tattoo. And that won't take too long. For your eyes, what kind of eyeliner do you want? Cat eye? Okay, just a second. Let me show you the stencil that I'm currently managing for my eye tattoos. Don't worry, for the eye tattoos we don't use any needles at all. It's skull tattoo, but it's just because of the ink that we use, which is permanent. It tends to fade out after a few years, and you will need a touch-up of color if you want, depending on the tone that you want, especially if it's black or blue. Okay, these are the stencils for the eyeliners that I'm currently managing. Right now we have the most popular, which is the top line cat eye liner. As you can see, the little tail is really long, which is one of my clients' favorites. Then we have the extravagant cat, which is this line right here. As you can see, it's very just a single line. There is no curve on it. Also one of my favorites. Then we have the fishtail, which is this one. As you can see, in the end, it cuts into as a little fishtail. We have the double wing, which is also a part on two at the end, but it's more curvy and not as wide as the fishtail. We have also the cat line top line, which is a little bit shorter as the first one that I show you. This doesn't go out too much of the eye. It's just right here. Very subtle. You can still see them, but it's not that dramatic as the first one that I show you. And then we have this one, which is also a little bit longer than this cat line, but shorter than the first one. Normally for people that prefer a more professional look, something on a day-to-day basis, they choose the short one or the medium one. It all depends on the taste on what you want. You would like to go with the medium one? Okay, very good. And about the color, regular black. Perfect. How about your lips? Okay. Kind of like a matte look. Matching your tone right now, natural. Okay, you don't want it to look too colored. Okay, I see what you mean. More like an earth tone. Yeah, we can definitely do that. Very good. Let me just then prepare everything. Let's start by pulling your hair to the back. Like so. We're gonna do first the tattoo cover up. For this, we're gonna do use the tattoo gun. You may already know how it works. Just the regular one. Okay. So let's see. Let's prep the area by cleaning it first. Can you close your eyes, please? I don't want any of the cleaner fumes to get to your eyes and get all with tears. Can be a little bit strong sometimes. Okay, good. I'm gonna slightly shave that part. I see a little hairs in the area. It's not that much, but it needs to be completely clear of hair. Okay. Very good. Here we go. Perfect. Let's take that out. Little hairs. So it's just a really tiny heart. It won't take too long for the tattoo to be done. Let's just now match your skin tone. I have my skin tone ink right here. Okay, if I match this one right here. Let's see. Yeah, that will work. I'm gonna put a little bit on you before we tattoo it, just to see how it matches. For your eyes and lips, we're gonna use a tool like this one, which what it does is just apply the ink directly to the skin. And this is what we're gonna use to try the ink first on the cover up, just to see if it's gonna match your skin tone. It's very important to have it correctly. We don't want it to have a odd color from your regular skin. Yes, it's the same tone that we use for under eye colorations and sometimes with freckles, just to cover them up. Okay, let's apply it here, like so. Just for a little bit. I'm gonna remove it immediately because we don't want it to get permanent in there before the tattooing. In this part we don't use this one in specific because the tattoo that you're currently having is deep inside. So I was done with the tattoo gun, and covering up it will look a little bit odd. Let's see. Yeah, it's the right tone. Good. Let's just take it out. Excuse me. For the eyebrows, yes, we do tattoos. We don't do microblading as in other establishments. We do just micro shading, which is shading the eyebrow, but not giving it a correct, well, not correct, but a full shaping. So we just cover up the parts that of your eyebrow that is missing or that is not that colored, and we help it look more full. Yeah, of course we can do it too. Let's see. So let's start first with the cover up. Don't worry, it's not gonna hurt. I'm very gentle with my clients. I know that it can be a little bit, get a little bit of anxiety to some people, so I'm very gentle. Good. So we're going to start by covering that part and using a new needle on you. New needle. Okay. Very good. There we go. Are you ready? Perfect. So let's start here. Here we go. Good, 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 good. Since the ink of the first tattoo is way deep into your skin, we need to do a few passes with the gun just to cover up the black with your skin tone ink so it gets perfect. Perfect. Let's see. Yeah, that's a great cover up. Very good. I'm gonna leave it there. Let me just cover it so we can start with your eyebrows first, then we're gonna move to your eyeliner and down to your lips. Okay? Let me just cover your newly tattoo, put some Vaseline on it so it heals faster. It's very tiny, it won't take too long. You already know how to take care of it, right? Good. Just cover up like that. Good. Very, very tiny. So let's start with your eyebrows. Let me first see how they normally look. What is what you want to do with your eyebrows? Fill it up Okay, let's examine them. You're wearing a little bit of makeup, right? Let me just remove it. Like so. Good. Oh, I see what you're saying. Yeah, micro shading will be great for you. What we're gonna be doing is just fix the arc in your eyebrow and see that it lost a little bit of shape. I don't do shaping, but I'm just gonna take a couple of measurements to make it look even with both eyebrows. Just get my tool here. Okay, now looking straight forward to me. Very, very straight. Like so. Okay, that's good. Looking straight forward, please. 2, 4. 1, 2, 3, 4. Good. Okay. So we're gonna be filling up the arc on both eyebrows and going down to the tail in the first part of your eyebrow is perfect. It doesn't need any ink there. It looks great. So we're just gonna help your eyebrows look a little bit fuller at the end. Let me just use my tool here to see that we are even in the measurements. Okay. Good. 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 Yeah, it looks great. Let's see the tone that we're gonna use on you. Okay, so we're not gonna make it too dark. I don't really like to use black on eyebrows because it looks, if your hair is not completely black, it looks very, very odd and too harsh on your face. So we're gonna use around 4 tones down just to soften the color a little bit. For this, we're going to use the micro shading technique. As I was saying, we're going to use the same tool as I was telling you. This one. What I'm going to be doing with this is creating tiny, tiny dots to fill up those little gaps that you have in your eyebrows and give the shape on the curve right here in your eyebrow. Okay. Let me just prepare the ink that we're going to be using on you. And we're going to be ready in a moment. Actually, this qualifies you for a discount since you're getting 3 treatments today. You try to cover up and lips, eyes, and eyebrows, so you get a 10% discount. we're gonna start. I wanna need you to close your eyes, please. Good. I need my cotton ball. Good. So we're gonna start where you're gonna feel slight pressure in your eyebrow area, but you shouldn't be feeling any pain at all. Okay? I really love this technique because it looks so natural. It goes below the hair of your natural eyebrow. It hides in there and it's not the lines that we see in microblading. It's tiny, tiny dots that blend with the natural hair of your eyebrow. And you can barely notice. You have to be very, very close to notice them. Okay. Good, good, good. Looks very good. Very, very good. Now let's move to the other one. Okay, very steady. This one doesn't need a lot of cover up as the other one. I try not to add too much because when you do that it looks like a straight line. So we have to space the little dots of ink so it looks natural. Yeah, this is a great technique for people that are afraid of needles and they want their eyebrows done. But microblading can hurt a little bit. You know, they are using a blade to cut the skin and put the ink in there. And this one is so tiny, the needle that I use, that you almost don't feel it. You just feel the pressure of me putting the object there, which is great for people that suffer of needle anxiety and are scared of it. I count myself included. Yeah, I'm a tattoo artist that doesn't like needles. Good. Perfect. Let's see now how it looks, if it's symmetrical. Looking good. Yeah. Just need to fill up a little gap that I left in there. Right here. It's kind of hard to catch when you're too close. It's normally visible when you see from afar. Didn't hurt, right? Okay. Perfectly symmetrical. Looks perfect. Okay, looking straight forward, very straight. Okay. Good. Perfect. So now let's just prepare your eyes for the eyeliner. We have to do a complete cleanup of the area. Okay, I need you to close your eyes. I'm gonna spray you some cleaner. It's organic, so it won't damage your eyes, but so it doesn't go inside your eyes. Okay, close them. Good. Don't worry, it doesn't affect the micro shading that I just did. Okay, close them again. Ready? Good. Keep them closed, please. It's perfect. So you went for the medium, right? Which will be this one right here. This one, right? The medium cat line. So we're gonna be doing it on the top eyelid right here. It's gonna be with this white, as you can see. It's not that dramatic, not as the other one, the big one. So it's gonna look very professional, very subtle, but it's gonna be still there. I just get mine, so plain black for this one, right? Good. I have a good ink that lasts longer than the regular ones. It's a little bit more pricey, but that's what you requested, right? Okay. So, during this, I will need you to completely close your eyes. Don't open them at all, because we don't want the line to be all crooked. Good. Okay, I'm gonna be standing up for this. Okay, good. So now completely still, please. Very, very important. I'm gonna start on this one. It's almost like coloring. Very subtle, elegant, classic. This one doesn't take that long. It's just a straight line. Okay, looking good. Good. There we go. Looks perfect. Perfect. So, we're going to do this one now. No moving at all, please. Perfect. Looking great. Can already see the difference. Now we're gonna put the sealer, which is gonna seal the ink that we just put. Okay, again, close your eyes. Keep them closed, please. Keep them closed, please. Now the sealer. This is going to be a bright light, so keep your eyes closed. It's going to seal the color. Good. Now the other one. Keep them closed, please. Perfect. Wow. It's a great difference. You can take a peek in the mirror right here while I prepare everything for your lips. You like it? Thank you. Okay, for your lips, before we add the ink, we have to do a slight exfoliation to remove any dead cells or dryness that it could be in the lips, because we need your lips to be fully clear, and so we can just add the ink on top, because if we add it to that skin in your lips, with time it was gonna scrape out. So I'm gonna use a new fresh set of lip exfoliators that is gonna allow me to remove all that impurities that are in your lips. As you can see, it has a tiny brush in it that it's gonna allow me to remove all the impurities on your lips. This is just a sample and not the one that I'm gonna be using on you. Okay, let's start by adding some slight exfoliator of brown sugar and water. Okay, so let's start. It does feel good, doesn't it? I love exfoliating my lips. It actually makes them more plump and healthier. You have to be very gentle with the lips not to damage them and create little wounds that it will make impossible for the ink to settle there. So I'm being very gentle with it. Okay, good. Very good. Let it dry for a little bit. How does it feel? Softer, isn't it? Yeah, it feels really, really good. Okay, so let's do the tone that you wanted. We're gonna do the mix up of your current lip tone, and we're gonna go 2 tones up in the arts tones that you wanted. Okay. Let's see. Using this one. Just gonna mix it well. Just waiting for your lips to dry up. Okay. We're gonna start by lining up your lips first. Same procedure. You're gonna feel slight pressure in your lips. Okay, now completely still. Don't do this, okay? Just normal like that. And open slightly, like this. Good? Very good. to do the liner first and fill up the lines like a coloring book. Let that settle for a little bit. I know you are gonna feel the urge to do this. Don't do it. Okay. Very good. Now let's fill up your lips. Just stand up for a little bit. Like so. Good, good, good. Looking great. Perfect. Let me just let it set for a little bit and do the final pass. Yeah, you can take a peek. It's gonna look a little bit not the right color, so we just need to do the other pass and it will look the final tone, okay? You like it? Oh, thank you. Okay, final pass. Ready? You can take a peek. That's the final result. And you can see along with your eyebrows and your eyeliner. You like it? So happy you like it. Well, now for the cares of your new makeup. Since this is not regular makeup, it's permanent makeup, but it's gonna fade up with time. It's gonna take years for that, but I do recommend to get a touch-up in around for your eyeliner in 2 years, and for your lips that is doesn't take that much time. So I will say 8 months. Yeah, 8 months, and or whenever you start seeing and noticing that it's fading out, you can come to us and do another touch-up. Yeah, it's extra cost. for your eyebrows, since it's micro shading, it's not like the ink going deep inside you. It will take 8 weeks. When it's gonna start fading out, you can come for a touch-up. It's gonna be half price because you're a client with us now, so it's not gonna be that costly. And you will need another touch-up every other 6 weeks or so. Any questions? Okay, aftercare. Don't use any makeup removal for the next 3 days. I recommend you not to use makeup for the next 2 days. Nothing on your eyes or your lips. We're gonna let the ink settle into your skin. You can wash your face with soap and water, regular soap and water, not brushing too much. Don't use exfoliators for the next week and a half to be safe. For your tattoo, well, to cover up the tattoo here, let me take a peek. Since it's very tiny, it won't take too long to heal, so you know the drill. Just soap and water, especially if it's natural soap. Okay, any other questions? Well, it was a pleasure serving you. I hope that you enjoy my work, and you have any questions in the future, just contact me, and I will be available on the phone or email. Oh, it was a pleasure. Take care. Bye-bye. Excuse me? Oh, I'm so sorry. I forgot. I'm so sorry. Okay, let me just take it out. There we go. Thank you. Goodbye.